Five, four, three, two, one. I'm John Miglosh for the Wisconsin DMA and the International Society for Strategic Marketing. Okay, well, we got a lot of interesting stories. Warmer weather heats up Scandinavian's wine industry. Well, there isn't much of a wine industry, actually. It says this is one of the challenges with doing news. Warmer temps are redrawing the winemaking map. Climatologists predict by 2050 that Scandinavia will warm as much as 43 degrees Fahrenheit. And it gets to 80 or 90 in the summer. So let's add 40 degrees to that. Let's see. That would be 120 degrees in the summer. Yeah, okay. That won't grow wine good unless, if you think you can grow in the Sahara Desert. That's not 43. It's not 43 degrees. It's 4.3 degrees Fahrenheit, if that. And yesterday was the all-time low temperature. Got down to like 5 degrees here in Wisconsin, the lowest temperature ever. So, good luck with that. And over the summer, yeah, they saw grapes burn on the vine at 105. So, as the world gets warmer, don't look anytime soon. They only have like an acre of land up in Scandinavia dedicated to wine growing. So there's 2 commercial vineyards. Oh, Denmark in the last 15 years went from 2 commercial vineyards to 90. Well, that's a nice play. But this is the trick. It might be good marketing ploy, but it might not be the greatest investment ever. Okay, this was, I thought, funny. I didn't realize that Anheuser-Busch and InBev merged, so that just shows you where I'm at with the beer industry. So we got a wine story and a beer story. But Anheuser-Busch decided to purchase the remainder of Oregon-based Craft Brew Alliance for around $221 million. Okay? The big Bev giant already owned 31%, so they just bought the rest of it. And they paid a huge premium, but but now they own a bunch of the craft beer industry, and but there'll always be craft beer, right? And that's the way it is. So enough of that. We'll let that go. Don't try to close these. Okay, now before we go too far into this story, eMarketer announces that U.S. TV ad spending has peaked and now is in decline. U.S. TV ad marketplace peaked, and here's the graph. And this is all extrapolated. And there'll be big spending in 2020 because of the election. But it's all downhill. And Mark Ritson pointed out a couple of years ago that just because kids are watching less TV because they have smartphones and all these other gadgets does not mean that adults who sit at home at night won't watch TV like we have forever and ever. Plus, with QR code, somebody discovered the QR code on TV. There may be an increased bump in TV ad spend. Who knows? I don't watch network TV hardly at all. Too many commercials. But I do watch sports sometimes. Although it's great. The NFL has put up like a 15-minute version of the game afterwards. And man, oh man, you can get a lot done with a 15-minute. Instead of 3 hours, it's 15 minutes. And it's pretty much every meaningful play. You don't get all the nuances, but you do see what's going on. So I highly recommend that if you're not into watching TV. But I do have an antenna on my roof. So there you go. Is it declining? And not very fast. And it's the digital TV network, guys. So okay, here's a good article. This is a great article. Okay, Sarah, we're going to have to send you a connect. Smell Touch boost in-store sales by 10%. What they did, it turns out to sell sneakers. There's nothing like the smell of freshly mown grass. There was here's the great part. Sales in the grass-scented stores rose 28% compared to those without scents. Hopefully they controlled for the the sales force not necessarily being better and all these other things, but this was great. In stores with added sensory details, consumers lingered 6 minutes more compared to stores in the control group. Now, what I thought was great was that there was a control group. That is unbelievable. You don't see this ever anymore. We measure everything. We have KPIs for everything, but does anybody run a control group? No. That's what a holdout test is. That's what an A-B split is, if you do it right. If you do it right, you should almost always do an ABC split or an ABCD split but it's hard to control all of that stuff. So what that means is that we quantitatively measured the impact of the in-store experience. How much do these things really matter? This is great. And of course, you go into the big department store and you will have to walk through the perfume spraying area, which I never quite liked, but I think my wife did. And blends of cinnamon, orange, vanilla, rosemary, green tea, lemongrass, all backed by market research. Some scents are instantly recognizable. While some research has found that as much as 75% of emotions generated each day are due to smell, the goal is not just good smell, but a specific scent tied to an emotion and a behavior. They also put up more mirrors in some of the stores, and that the science of narcissism is also in play. That could be applied to digital. If you're selling eyeglasses and you have a way to put it on their face or something, it's a lot of expense. I would say the best way to get touch and feel, engagement, and smell into your marketing, try print, try mail. You can do both. You can change the touch. You can put engagement, peel off stickers, sticks, do that sort of thing. You can do all of these things in mail. Just saying. That's why I wanted to talk about this. Okay. Here's my concluding story. The U.S. can slash healthcare costs 75% with two fundamental changes. Just two changes. Not only that, but these policies have been proven. Whole Foods has been doing it and Indiana and Singapore, and it would save us $2.4 trillion as a company per year. Okay, never mind about Medicare for all. Okay, this is something we can do right away. But you say, well, why is a marketing guy talking about this? And I'll tell you why. It's because it has to do with marketing. Karl Marx thought, he knew that something like 30% of the price you pay for an item is devoted to marketing and advertising. And he thought that was a total waste of money. And communist countries are absolutely against advertising and marketing. And so if you're leaning toward socialism and you work in marketing, you might want to reconsider. Because advertising and marketing are one of the factors that companies have to compete in. Another factor is price. So the first policy is price, but you also have to be able to tell people about it. Okay? Now, people say, oh, just knowing the price. Right now, there's no way to comparison shop. My wife went in. She had some kind of a thing happen with her finger. And they treated it at the urgent care, not the emergency room. They told her to go to there. And so a doctor put a splint on it and said, there's not much you can do, but you might want to see a specialist. Okay? So then a couple of weeks later, she went to the specialist. And the specialist unwrapped her finger, wrapped it back up, and we got a bill for $2,000. Took him about 10 minutes, maybe 5. Talked to her a bit, said, there's not much we can do, but they x-rayed it. $2,000. We complained. They said, well, that's the price when you see the specialist. But there's nothing they can do. Right. Well, we don't care about that. What we care about is that they might have to do surgery. And so we bill everything in case you have to do surgery. Okay, that's the kind of baloney that's happening in our healthcare system, right? I paid, at a price per hour, I paid something like $12,000 an hour for that little booger. with no surgery involved. Okay? Now, if you want proof, LASIK eye surgery. LASIK eye surgery, I remember it costing about $5,000 an eye when it started. Now you can get it for $500 an eye if you look around on sale. This is a little less, but I know in Wisconsin it's possible. My wife went for a little minor eye surgery, and they said it was $2,000, I think, or maybe $1,000. And then she said, "Well, I don't have insurance for eye surgery. How much is it?" They said $200 in cash right now. How about that? Amazing. Say I'm not paying with insurance. Oh, okay, we'll give you the real person price. Unbelievable. Countries without insurance have their healthcare is a tiny fraction because there's layer upon layer upon layer of bureaucracy in our system. Okay? The other thing is price tags ensure that everybody pays the same amount, unlike the story I just told you. Okay? Now, what's the second policy? The second policy is you pair an insurance policy, a deductible, with a deductible, and a health savings account. Now, what does that do? Well, first of all, it means that your deductible is covered, right, automatically. But the most, and employers like Whole Foods has been doing this since 2002, the state of Indiana, the country of Singapore since 2007. And what happens is, so in Indiana, most of the people opt for this kind of coverage. So you get the coverage, you get the health insurance, what's covered is regulated, and then you get and then they also put in this $2,800 to cover the deductible. The great part is if you don't use it all up, you get the money. Guess what? It makes people part of the process. They say, "Oh, I'm not going to pay $2,000 for a 10-minute visit when they can't do anything anyway," right? Maybe you do a little research. Maybe you say, "Hey, I don't really know if I need that," right? And the result is massively lower healthcare spending without any decrement, which means, it's no worse healthcare. Okay? 67% are less likely to go to high-cost emergency rooms rather than the low-cost urgent care. You probably get quicker service at the urgent care. Okay? They also spent $18 less per prescription because they were more inclined to take the generic equivalents. All of this stuff. And we know that it can save 75% of what we're paying right now, in U.S. healthcare. Only one country's had the good sense to have it rolled out nationwide, even though this idea came from the United States. Singapore is able to deliver universal coverage and the best health outcomes in the world while spending 77% less per capita than the United States and about 60% less than the United Kingdom, Canada, Japan, and other advanced industrial economies. You know that the British healthcare system isn't the answer. You know that the Canadian healthcare system isn't the answer. This is the answer. This is the answer right here. We're spending 8% of GDP. Singapore spends 2.4% of GDP. You got to have people involved in the process. The waiter comes around at the buffet breakfast. "Would you like some orange juice?" "No." "Well, it's free. It comes with dinner or with breakfast." "Oh, okay." And what do you see after breakfast? Lots of half-drunk glasses of orange juice. I had a friend who had a free Coke machine, and he was always finding half-drunk cans of Coke. Finally, he charged a nickel. This is back in probably the 70s, but let's say you charge a quarter. You charge a quarter of what it's going to cost for a Coke today, and people would finish it. They didn't finish it because, well, it's a little warm. I'll go get a new one. It just shows you people are smart. People modify behavior. Let's get this good sense to get marketing involved in the healthcare system. Get marketing involved in the healthcare system. That's the answer. Like and share. Your friends will think you're smart.